there, and welcome to my second installment. I'm going to call it Our Body, Our Temple, because we're going to be working on some exercises to help with pain, inflammation, and that kind of thing. My name is Trenda, and actually I'm from CDI College. I'm working later today, so I thought I'd just wear my scrubs. I'm a practicum student and doing rehabilitation therapy assisting. I'm at a physiotherapy clinic right now, so what I'm going to be showing you today is about knee pain. So some people have had dislocations, ligament, tendons, different tears in their knees, they've had surgeries, that kind of thing. So of course, listen to your doctor's orders first. Make sure you're doing okay to be able to do some of these exercises. If it's not okay, back off. You don't want pain, okay? So to start off with, I'm just going to show you tip number one, which is the main exercise to do for knees, would be straight leg raises. So if you do it, you can do it standing, seated, or in your bed. And what you want to do is make sure that your weight is evenly distributed before you start. Knees are soft, and you're going to bring one leg up, and you can flex your foot or point it, doesn't matter, and just keep your leg relatively straight, but don't lock your knees. So that's really the key to this one. And you can go to whatever level, so it may be down here or it may be higher, depending. And take your time with it, same as with the footwork. And remember from last week, footwork is your foundation, so it's great for your knees too. So just remember that one. The next movement is actually, I would normally do it against a wall, but you'll just have to visualize. So what you're going to do is bring your shoulders back against the wall and also your buttocks. And you're going to walk your feet out and start to come down on that wall. So you're sliding down the wall, and only go to a level comfortable for you. You need to be able to get back up. So just be sure and do that. Mimicking that same type of movement almost is doing mini squats. So for mini squats, you want to make sure that your feet are wider than hip distance apart, because you want a wide base of support for stabilization. So planting your feet down, you may want to outturn your feet a bit if it's more comfortable for your knees, and actually usually it is. And then what you're going to do is track your knees and toes. Making sure you don't go over your toes is really important. And the other thing is really engaging your core. And what you want to do is bring your bum more towards the back. Good. Next movement is a partial lunge. So what you want to do with this one, make sure you're not walking a tightrope. You want to have your feet a bit apart. And what you're going to do is step forward, and then we're just going to bend the front knee to begin with. Make sure you do both sides, and of course, again, 3 sets of 10 is great. You may have to build up to that. And then eventually what you want to try and do is lift up onto the ball of your foot, bring your other knee down, straight down, and then bring it back up. And only go to a level of comfort, of course. So again, from this side, step forward, and then just bend your front knee. Make sure it doesn't go over your toes. Or lift, drop your knee, bring it back up. Again, lift, drop your knee, bring it back up. Good. And then if you have a hardcover book, this one is not very thick, but stepping up and down, really important. Or you could just march your legs. So stepping up onto some type of platform and back down. Super good for working your quads, your hams, and your glutes, which are really your prime movers. And if you use them, you'll always be able to get up from the toilet. Really important. And the last one I'd like to talk about is cycling. And cycling actually on a stationary bike or just mimicking that action is really good. So if you're in bed, you can just bring your legs up, but if you're using it standing, what you can do is bring your toe up, pointed, bring it back, nice tall posture, flex, bring it through, point again, flex, and bring it through. Again, I'll show you from this side. So point, drag, heel, bring it out. So it's kind of slow motion. Bicycling is the best because then you're working through all those little tendons, ligaments, and everything like that. So tip number 2 is about pain and inflammation. So if you are having acute pain, you want to use ice. So either an ice bag, ice pack, frozen peas, and wrap in a towel and then put it around your knee and for 5 to 10 minutes depending. Check your skin, make sure everything's good, you don't have frostbite. And then if it's chronic pain and it's just kind of nagging, throbbing, then you're going to want to use heat. And with heat you can use a heat pack, a magic bag, something like that. And again, you could probably go for a little bit longer with your heat because you're therapeutically trying to relax some of those muscles and tendons and things. And so that is really good. Compression bandages are another option because the feel of that, again, it depends on your health condition, so always check first. But you could use a compression bandage or a splint to kind of guard your knee too, so that if it is dislocated for any reason, you want to keep it in correct alignment. So that, and then my last tip, tip number 3, is making sure that you have a proper diet, because if you have excess weight, it's going to be really hard on your joints. So my tip is to try and reduce sugar intake or eliminate it completely. That will help with weight loss. It will help with arthritis in your knees. So really good. And so finally, I'd like to just set all of these exercises to music as per my previous and demonstrate them again. So feel free to stay here or start again. Okay, so we're going to start with straight leg raise. Ready, and 1, 2, 3, 4, 4, 3, 2, 1. Are you tall in your body? 1, 2, 3, 4, 4, 3, 2, and 1. Very good. Let's do some mini squats. Wide base of support, toes slightly outturned. Let's go down. 1, 2, 3, 4, 4, 3, 2, 1. Partial lunges, feet apart, step forward, knee. 2. If you need to bend your back knee, that's okay. 3 and 4. Lift up onto the ball. Let's go down. 1, 2, 3, 4. Let's do the other side. Ready, and step forward, down. 2, 3. Just your knee. 4. Not over the toe. Lift. 1, 2, 3, and 4. Let's step up on our step. Up and down. Make sure your heel's not hanging off. Or march. Do we have time for cycling? Probably not. We can try. Toe. No. Heel. Let's do it anyways. Drag it back. I got my book in the way. 3. That's what happens with videos when you're practicing, different things happen. There's a lot of logistics. Okay. Drag back, flex. Drag back. So again, you're going to want to do 10. I usually do 8 just because of music counts. But if you're just doing them silently, you can do them that way. And I would like to thank you very much for joining me for this session, and I hope to see you at my next one. I'm thinking about doing either our torso or our prime movers, thighs, hips, and glutes, which will probably be more squats. Yay!